right, welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Aishwarya Raja and Inhinia Henao. Aishwarya is a medical student, Inhinia is an internal medicine physician, and together they co-wrote the article, Unmasking Inequality, the Power of Community Organization During COVID-19. Welcome to the show, both of you.
Thank you for having us.
Thank you for having us.
Aishwarya, I'm going to start with you. Can you share your story and your journey to where you are today? And we'll get into your article in a little bit.
Of course. Hi, everyone. My name is Aishwarya. I am a fourth-year medical student at Mount Sinai. And growing up in northern New Jersey, I really was actively involved in community service and from a young age developed a love for advocating for and working with underserved communities. My parents instilled in me the value of education, but they also reminded me of my power and privilege as an individual and the importance of giving back to those who are the most in need. And so now as a medical student at Mount Sinai, I've really kind of continued this work in advocacy, working with underserved and also conducting research on the disparities and health outcomes among these populations. And this is manifested in my leadership at Mount Sinai Student Run Free Clinic, my grassroots organization, Mass Transit, which I talk about in this article in particular, and most recently my research, where I worked for a year at Beth Israel Deaconess Medical Center. Really hope to have a career that blends this research, advocacy, and clinical work, and particularly touches the lives of underserved populations.
Wonderful, and best wishes on your residency interviews coming up. And Inhinia, can you share your story and your journey to where you are today?
Sure. So I am originally from the Dominican Republic. I came to New York City when I was 15, and then I studied I went to college close to New York City, Marymount College. And I did my internal medicine and residency at the University of Rochester. That's when I think for me, my work with the underserved communities started. I did a summer internship at one of the community health centers in Rochester. After I finished residency, I went to work at Emory University in Atlanta, and I was based at Grady Memorial Hospital. So working with the inner city hospital, attending to the community, gave me a lot of joy, and I have been doing that ever since. At Emory, I created a department that we called it the Department of Multicultural Affairs. We also had the International Medical Center addressing the needs of the community. And when I came to Yale, it was very similar, working in the underserved New Haven community. Mm-hmm. And I led the clinic for the residency. Now, what I'm doing is leading the efforts on diversity, equity, and inclusion for both the Department of Medicine and also graduate medical education. So we're doing a lot of work on diversifying the physician workforce because we see the benefits of having a diverse workforce of physicians that address and basically correlate with the patients that we serve.
Excellent. So let's get into the Kevin MD article that both of you wrote, Unmasking Inequality, the Power of Community Organization During COVID-19. Aishwarya, for those who haven't read the article, can you just walk my audience through it and share the story why you decided to co-write it?
Yes, of course. So the article really came about as a natural progression of the work that we had already been doing for months around the time that COVID-19 had really hit New York City the hardest, which was in April of 2020. And so it's a summary of the efforts of this grassroots organization that I founded, Mass Transit, as well as the lessons and things that we learned along the way in terms of the importance of community organization, the importance of mobilizing groups from different walks of life to address a major public health crisis. And so mass transit itself, I decided to found this organization in April of 2020 after seeing kind of the disproportionate impact that COVID-19 was having on communities of color, those who are low-wage frontline workers, and those who are undomiciled. And I really wanted to make a difference in a way that was important for these individuals. And so I mobilized a group of medical students at Mount Sinai to develop a concerted effort to provide masks and educational materials to these communities. And so starting in New York City, addressing the needs of the East Harlem community members, and then quickly expanding to include efforts in New Haven, Connecticut with Dr. Hanau, as well as in Boston and other major cities, we really were able to create this national coalition of individuals who were addressing this particular gap that existed in our society. And so that's how Dr. Hanau and I connected, and we knew that this was a story that really needed to be broadcasted to a wider audience.
And Aishwarya, give some specific examples of the impact mass transit had. Can you give some stories of specific families and patients that your program has impacted?
Of course. So mass transit, initially, we wanted to target the patients and families that were seen at Mount Sinai Student Run Free Clinic. And so there's about 300 patients that are served at that clinic. And if you multiply that by 3 or 4 on average number of individuals within their household, we were able to provide over 1,000 masks and educational pamphlets to these individuals alone. And just one example of a person or an individual who really touched me personally was a patient that I worked with at the clinic who was a low-wage frontline worker. She had a very difficult job working at a deli, and she expressed to me the difficulty of attaining masks at a price that was affordable to her, and there were also shortages at that time. And so working with her and realizing that these masks could really impact the lives of patients like my patient really was the catalyst for the eventual founding of this organization.
Wonderful. And Hinia, in your practice at Yale, whether inpatient or outpatient, can you share some stories and examples of the disparity that COVID-19 really is exacerbating?
Sure. During the pandemic, I was doing a lot of telehealth, addressing the needs of the patients that way. And what I heard from my patients was the fear of seeking care because of contracting COVID in the hospital. So many of them were not, leave their homes, much less, seek care when they were sick. So what we saw was a worsening of chronic conditions because of fear of seeking care. The other disparities that we observed was, obviously this is not just in New Haven, but throughout the country in terms of people of color being disproportionately impacted by COVID. The other, and this is where I think that need for addressing the community with masks was the driver for me, because the patients had issues with social distancing. Many of them live in a very crowded home environment. Mm-hmm. So we immediately couldn't say, okay, here's a home for you. But what could we have done? And so the easiest thing was to educate and provide masks. So we had basically like a mask drive going out into the community to educate them, along with providing them a mask. So that's what we initially did.
And in Hinia, we are speaking in the last week of December. In fact, we're speaking on New Year's Eve. That's right. And now we have 2 vaccines that have been approved, and possibly a third one that's going to be approved within the next month or so. Can you share some of the obstacles people of color have when it comes to perhaps accessing the vaccine going forward?
Well, one thing is that it's not yet available. Mm-hmm. I have been vaccinated, but it's not yet available to the community. I think the main obstacle is trust, the trust in the medical community, because there is a strong history of we physicians, we the healthcare workforce, and basically abusing the underserved communities. And so we have to regain that trust. And that is one of the things with those of us in the healthcare getting vaccinated is a way of saying this is safe.
Mm-hmm.
I did it myself, and you can do it too. So I think the top barrier that I see is trust when that vaccine become available.
So I'm an internal medicine physician as well, and I agree that there's a lot of skepticism right now to vaccine. On my Facebook feed, for instance, I see a lot of patients having a lot of questions about the speed that the vaccine was produced. So in Hinia, if there's a patient in the exam room and they have questions about the vaccines, what are some things that I can say to them to help them with that trust?
So I would say, putting myself first, as I mentioned, I got the vaccine.
Mm-hmm.
I put myself in their shoes, and I can tell them my experience with the vaccine. I had a sore arm, a little bit more sore than the flu shot,
Mm-hmm.
but otherwise I had no symptoms myself. And then if we take it to just based on the population, so based on the studies done on the vaccine, the side effects are so minimal compared to the actual infection of COVID. So I think we have to put it in perspective, the vaccine side effects versus getting the infection of COVID, which has so many other complications that we still don't know.
Mm-hmm.
So, like we may not know all the side effects of the vaccine, let's say 3 years from now, but we also don't know all the potential complications of COVID 3 years from now. So I think it's basically a way to measure the side effects versus the actual infection.
Ashwarya, you co-wrote that article back in October 2nd, and again, we're speaking in the last week of December. Now, what do you anticipate some of the ways that medical students can be involved, hopefully the last few months of the pandemic, and what do you anticipate some of the challenges to be going forward?
Yeah, definitely. And kind of speaking a little bit about this, the vaccination misinformation and how we can help as medical students and also help through mass transit and these grassroots organizations. Looking forward in the next couple of months, we are now trying to partner with faith-based organizations and community-based organizations within East Harlem and other communities as well to form these partnerships with the aim of really bridging the gaps and kind of dispelling some of the myths and misinformation that really exists surrounding the vaccine. And so working alongside physicians of color, working alongside faith leaders, bridging these gaps and perhaps even forming new connections that had previously not been formed are ways that medical students can help. And so we will be planning some live virtual community Q&As with physicians as well as faith leaders. We're creating pre-recorded digital content with physicians of color speaking about the vaccine and answering some of the most common questions that the community members have, and finally disseminating it widely. And so this includes email listservs with these faith organizations, perhaps kind of forming a digital way of broadcasting this information through electronic health records or other means. So we're always kind of thinking ahead about how we can get medical students involved in addressing these issues in a way that is smart and really tailored to the communities that we're working.
And if I'm a medical student and I do want to get involved, whether it's your organization or other organizations who do similar things, what are some resources that you can suggest? Yeah,
so I would say definitely if a medical school or medical students are involved, you can definitely reach out to our organization in particular. And we have a lot of community ties. So we can either kind of connect them to communities within or community organizations within their cities that are already doing something similar, or they can partner with us. And so you can email us at masktransit@gmail.com or go to our website, masktransit.org. And all the information is there about how to get in touch with us. And we are more than happy to include more medical schools and cities to really bring this out nationally.
Great. And we are talking to Ashwarya Raja and Inhinia Henao. They both co-wrote the Kevin MD article, Unmasking Inequality, the Power of Community Organization During COVID-19. So I'm going to end by asking both of you the same question. Ashwarya, I'm going to start with you. What is your take-home message that you want to send to the Kevin MD audience?
So I would say the take-home message is for situations that require swift and judicious action, it's really important that formalized institutions like like hospitals, government, distributors, manufacturers, they really leverage the power of community organization and pre-existing infrastructure to deliver effective and sustainable solutions. It's not enough to work in isolation. It's important that all of these parties get their message heard, and we work together to formalize a response.
And Inhinia, what is your take-home message that you want to leave with the Kevin MD audience?
Sure. I think what I would like to say is that when we are facing a major issue like the COVID-19 pandemic, sometimes it's paralyzing as when we think of ourselves as individual. But just one person sharing an idea with another person can actually be a catalyst to something major, to basically to come together and unite forces to do the best we can for the community. Because as individual, there is so little we can do at times. But when we come together, we can actually do a lot better and have a stronger impact on the community that we're serving.
Wonderful. Well, thank you to both of you for sharing your insight and time. And thanks again for being on the show.
Thank you for having us.